Hello and welcome to Medical Dialogues show. I am Dr. Nandita Mohan, and today we have with us Professor Dr. Anil Jain, who is the editor-in-chief of the Annals of the National Academy of Medical Science, which is the official publication of the National Academy of Medical Science under the aegis of Ministry of Health and Family Welfare, Government of India. He is also a senior consultant orthopedic surgeon at the University College of Medical Sciences and Guru Tegh Bahadur Hospital. We also have with us Mr. Pritesh, who is the CEO of Scientific Scholar, as well as Dr. Sunny Datta Gupta, who is the director publishing at Scientific Scholar. So welcome to Medical Dialogues, sir. It's really a pleasure to have you on board here with us.
So
today.
nice of you. Thank you very much.
Thank you.
Thank you. Thank you.
Great. Dr. Anil, if you could just, firstly, congratulations for the launch of the new face of the journal. If you could just share what is new in this volume and what all readers can expect from the journal going forward.
Yeah. I think what I believe is that for us, journal is not publication of 100 pages. It is an example that where we are in medicine today and how and what path we are going to take in future. And that is most important because ultimate goal of medical fraternity is to help the person in pain, that is the patient. Now, if we keep that in mind, then all research published must reach to every person in the country and in the world, so that from a small research conducted in one part, it can benefit every clinician, it can benefit every patient throughout the globe. Now, this can only be possible if the journal visibility is very good. Now, for that, this journal is almost 60 years old. We are running the 60 volume. Why we are calling it is a new phase, because we are now have started working with that objective that in 1 year or 2 years time, we must reach to each and every clinician. We must reach which can benefit each and every patient. And with that mind, we have started working, and we have not only, it is not the new launch of a cover page, which you can see, it is the content also that we are now worked out that in times to come, we are going to have, besides the usual element of a review article and an original article or a case report, we are going to have one section in the journal where we are going to give some guidelines, some state-of-art recommendations for some conditions, so that these can be used at the periphery. And in this first issue, we are coming out with 3 task force reports on venous thromboembolism and on organ transplantation and alcohol and substance use. In the next issue also, we are coming out with 2 task force reports. Now, these task force reports being prepared by a committee of experts from the country, selected by National Academy of Medical Sciences with the representative from Ministry of Health. And they have prepared these, and we are aiming that some more would come in times to come. But besides this task force report, because this is a multi-speciality society, National Academy of Medical Society is a multi-speciality where all experts, best researcher in all subjects are part of it. And hence, the Journal of Annals must reflect ANAMS, and this journal is a multi-speciality journal. So we want more and more interaction between the disciplines and come out the treatment, because it is the treatment of human body and not one organ system. So we want that it should be useful to treat the patient, and that is why we are planning to come out with some symposiums, some subject symposiums where multidisciplinary participation would be there in times to come, so that our final goal of reaching to each and every clinicians, each and every doctor to help each and every patient is fulfilled.
Great. So congratulations once again, sir, for the new face of this journal. Now, coming to Mr. Pritesh, if you could just give your views on what is your take on this new face.
Thank you, Nandita. It's a pleasure to working with such a prestigious organization of Government of India. And as sir said, it's not just a new face or new cover. The whole new things are going to come with the journal. The experience for the authors, reviewers, and editors is going to be tremendous. That's what we try and achieve. And the ultimate aim of the journal is to reach to every nooks and corners of India. That's what we try to achieve, and we hope that we'll be able to matched the expectation of the NAMS, and will do better in terms of reaching out to the end users.
I think I just would like to add one thing, that I would like to request each and every authors in the country to submit the best research in this journal, and all clinicians to come and help as a reviewer, and all those people who have helped us as an associate editor, as a reviewer, as an author, I would like to present my thanks to them.
Great. Coming to Dr. Sunny, if you would want to add on anything to this.
And thanks, Dr. Nandita. As the scientific scholar, we are aiming to take the journal Annals of National Academy of Medical Science not only to the nooks and corners of the country, but to the nooks and corners of the globe, to all the countries outside India, especially to the developing countries where the clinicians, the researchers, and of course the end reader and the patients would benefit from the high quality content that we are publishing, and under the leadership of Professor Anil sir and Mr. Pritesh said, we are committed to open access publishing, and we will ensure that the journal reaches tremendous heights of academic success. Thank you.
Great. So thank you so much, Dr. Anil, Mr. Pritesh, and Dr. Sunny for joining us today at Medical Dialogues. It was lovely to be interviewing you today.
So nice of you. Thank you very much.
It's a pleasure to be here. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.